Yeah, good evening, viewers, and thank you for tuning in. We hope to have a very good discussion again about fibroids.
Thank you.
Yeah, thank you.
Yes, it's still Medical Mind, and let's go straight because of time, and we look at our illustration on the screen. Our topic today, Doctor, is about uterine fibroids.
Yes.
And I'm sure many mothers are outside that have been waiting for the topic. So here's the day. Let's start off, Doctor. What exactly are fibroids?
Yeah. So it's very important to know what fibroids are. Now, so the simplest definition is that fibroids, these are abnormal swellings within the muscle wall of the uterus. Okay. Yeah. So they arise from the muscles of the womb, and so they grow. And they grow and they are abnormal.
Okay. Is it always one? Can there be more than one in the uterus at a particular time? Yes,
so fibroids, they have variations of characteristics. Some people have one, others have two. Majority of them, like over 60% of them, are multiple. So when you find one, there is usually another one around. Okay. So most of them are in multiples. So, but the numbers do vary.
Okay.
Yes.
Thank you so much, Doctor. How common are they?
Yeah, this condition is very common actually, especially in the reproductive age, between the age of about 25 to around 45. If you look at the statistics, some slight variation, but in our population, we think about 3 to 4 women out of 10 actually do have fibroids. That's in the general population. But again, the incidence goes higher among the people who have infertility. Among the infertility patients, we see about 60% of them. That's 6 out of 10. The good news is that not all of them are problematic. Okay. Yes, so that's why we don't do so much interventions. But those which are causing problems, judged by the doctor, then they need to be treated. But they are very, very common. I think almost every woman knows about fibroids.
True. Yes. Some of us hear about them, but we don't know much about it. We just know it's fibroids, but yes, we don't. So how do you know that this one is problematic and this one is not? Yes.
So fibroids usually problematic is they are those which show you symptoms. Yes, and the commonest symptom we have is bleeding, abnormal bleeding, of course, depending on where the fibroid is located.
That is during periods, menstruation, or?
Oh yes, that's a very good question. Now, the bleeding of fibroid is very, very characteristic. Okay. In most cases, bleeding caused by the fibroid is regular. That is, the bleeding comes when you expect your period. It's actually a period, but it is heavier.
It lasts the normal flow.
Yes, it lasts for a longer time. So if your normal periods usually last for about 3 days, and you find if you have fibroids, you will be bleeding for more than 5 days, and then there should be something. Or each day, if you are using like 2 pads, this time around, if you have fibroids, you may be using like 5 pads.
Really?
Yes, in some people actually they can have a lot of bleeding and they even become anemic.
That is a serious sign.
Yeah, so that's one of the commonest presentation. Okay. But also, often people feel a mass. Because in the belly. Yeah, they feel a mass. So they may feel the mass by themselves, or they see that the belly is increasing in size, or you find that they have symptoms because of the mass effect. Okay. For example, it starts pressing on their bladder, so they start passing urine frequently, or they are not able to control their urine very well, or they have issues with stool. So those are the commonest presentations. But also in a few people, we see the fibroid related to miscarriages. Yes, so somebody is having pregnancies, but they keep on coming out. And when you check on a scan, you find the person has a particular type of fibroid, which is pressing in the space where the baby is supposed to be growing. So these are some of the presentations. But of course, some of them are not with symptoms. We need to know. Okay. Yeah, so those which without symptoms usually are not very problematic. Okay. Yes.
Thank you. I wanted to ask you a question, but you've answered it already. It's okay. Because it's very common for mothers to conceive, and then they have miscarriages, only to discover that there is a fibroid growing somewhere. So I was thinking of asking you how this fibroid gets close and squeezes the baby, or how it makes that
miscarriage, how it causes the miscarriage.
Yes.
So maybe we can look at our illustration on the picture here.
Okay.
let's look at this. I hope the one with fibroids, let's see the one with fibroids. I think number 2, yes, this is the real one. So if you look at number 1, let's have the other image without fibroids.
The first one without fibroids?
Yes, without fibroids. Yes, this one here, yeah, this is the muscle wall of the womb.
Okay.
Very smooth and regular.
Yes.
And inside here, what you see as red is the space where the baby grows. Okay. Incidentally, when the baby comes after fertilization, the baby digs through this layer and comes right deep inside here. Now, it gets blood supply through the muscle, blood supply, and then it grows and grows and fills this space.
Okay.
That's the normal situation. Okay. Now, if you look at when you have fibroids, like what we see in the image 2 here, like a fibroid like this one or this one, these are problematic fibroids, even this in terms of pregnancy. Imagine if the baby comes here and attaches here, and the placenta is supposed to be forming over here. Now, the blood supply here will be, the formation of the placenta will be interfered with because of this fibroid here. And if it goes here, and that's the same thing. Fibroid is parasitic. So
basically, it keeps taking away the space where the baby is supposed to be.
Yeah, it takes away the space. It disturbs the way the placenta is formed, and so the blood supply to the baby will not be good enough. It makes the attachment of placenta very weak, so that the placenta can actually peel off, and you get a miscarriage from that.
Peel off. That's what I wanted to hear. It peels off the placenta.
Exactly. It peels off the placenta.
Very good,
so
doctor.
Such fibroids should not be ignored. We have grades for them, so they shouldn't be ignored.
Doctor, if a mother is expecting and the fibroid is already there,
yes,
what do you do?
Oh yeah, so the logical way of managing that is, the moment the pregnancy is there, and that is the time you diagnose the fibroid, you don't do anything. Even if it is this type, for 2 reasons. Okay. One, if you touch a fibroid during pregnancy, chances are over 80% that pregnancy will come out.
Okay.
Second reason is the blood supply during pregnancy usually increases. And so if you won't touch the fibroids, the woman can, in most cases, bleed to death. And that is very dangerous. And the third and very, very important reason, which we always say, is diseases don't read books. Diseases don't read books because what you judge by your thinking and from your knowledge, that if the placenta is around here and maybe the fibroid is close, that it may lead to miscarriage. You will be shocked to find out that actually this pregnancy goes up to term and they deliver. So diseases don't read books. Once the pregnancy is in, give it a chance. But of course, if it comes out, then you should deal with the fibroid before the person gets the next pregnancy.
Thank you so much. Yes. Doctor, before you get back to your seat, how big does a fibroid grow? Oh my God, sometimes, we used to make jokes in medical school that, one of the treatments for fibroids is to remove the fibroids from the uterus. Now, we used to make jokes that in some surgeries, you are removing the patient from the fibroid instead of removing the fibroid from the patient, which means that the fibroid is so huge, so huge that actually you are detaching the patient from the fibroid. So they can grow as large as you can imagine. Very huge. Really? Yes. Thank you so much, Doctor, for all those illustrations. In case you've just joined us, it's Medical Mind. We are looking at fibroids and infertility. So Doctor was trying to illustrate and tell us where the fibroid attaches itself in the womb and how it can lead to a miscarriage in most mothers expecting. Are there some possible ways of preventing these fibroids from taking place or from the mother or getting it or some? Yeah, so the thing with fibroid is, fibroid first of all is a very old disease. All diseases are old, but in terms of discovery, we knew about fibroids long ago. If you read even history of medical history books, fibroids, some descriptions of fibroids were long ago, even Hippocrates, I think, saw them. But I don't know for what reason we didn't have much interest in fibroid science. And so it has been a lingering disease for long, and there are many things we don't know still about fibroids. You'll be shocked. For example, we do not know the exact cause of fibroids. And so if you don't know the cause of something, then you cannot be confident about saying that I can prevent it. But we know some risk factors. Okay. For example, now we know that there are certain hormones. If you allow a situation where your hormones remain high, estrogen and progesterone, for a long period of time, then fibroids can increase.
Another thing is the weight management. Yeah, so if your weight is too much, your hormones are likely to be high. You will expose your uterus to a high level of estrogen and progesterone, and so your risk of getting fibroids increases. So if you can manage your weight, you could prevent fibroids.
Okay.
If you eat well, you could prevent fibroids. Yes, and which is a little bit difficult to do is people who get pregnancies have reduced chance of getting fibroids. But then we can't advise people to be getting kids just to prevent fibroids.
Let's talk about that, doctor, before you go. I have a friend. She's a teacher. She took long to give birth. Her last child was, I think, 9 years.
Yes.
Then she started having cramps, stomach pains, all that. When she went to the hospital, the doctor told her, you know what, teacher, you are developing fibroids.
Yes.
The only way for you to prevent it is to start giving birth again. Because she gave birth at an early age.
Yeah.
And trust me, when she went back and gave birth, the first child, the second child, she became okay. So you're confirming it that giving birth is one way of keeping the uterus healthy from
yes, yes, but of course you have to weigh the options. You know, you have to weigh. If you're going to get 10 kids because you want to prevent fibroids, and of course fibroids are not in everybody, and not all cases of fibroids are significant, then you're not doing yourself a good service. And besides, fibroids have treatment.
Okay.
They can be removed. So I think the advice, it's an epidemiological observation that people who give birth have less risk of getting fibroids. It's an epidemiological observation, which is not very, very applicable in clinical situations. Yeah?
Okay.
Yeah. Okay. So I don't want to advise people to go get many babies so that they prevent fibroids.
They're trying to fight fibroids.
The risk of looking after many number of babies
also
is much more than
okay. Thank you so much. Thank you so much for still keeping with us. It's still Bethany TV, and we are looking at fibroids. Dr. Andabati is in the studio. In case you want to be part of the show in the next coming minutes, you can prepare the numbers 0786 050 762 for you who has just joined us today. This program will take place every Sunday from 8 to 9 p.m. So please be a part of the show, and especially the mothers. We talk a lot about our body. We know our body, and Dr. Andabati illustrates it to you practically, and you get to know exactly how to handle certain medical conditions that you could be going through. So those are our numbers, those are our lines. Please prepare all your questions, and you can WhatsApp us, and we get the questions right away, and Doctor gives you a clear answer. Doctor, let's look at the common signs and symptoms of fibroids.
Yes.
Yes. How do you know that I have fibroids? Yes.
Yes, and thank you very much, Teacher Zita. That's a very good question, and it is a good starting point. How do I know I have fibroids? In the cases which present with symptoms, there are certain symptoms. But I have to tell you that about 60% of the fibroids have no symptoms at all. That is 6 out of 10 of the fibroids you don't get to know by symptoms. Many of them are discovered. But those which present with symptoms usually present with heavy periods.
Heavy period is the first indicator.
Yes.
Abnormal
periods. So more commonly it's heavy periods. So the periods are heavier per day, and they last for more days.
The normal one should at least be 4 to 7 days.
A normal period should be between 2 to 5 days.
2 to 5.
2 to 5 days, average of 3 days.
Okay.
Yeah, but if for fibroids, you find the period is for more than 7 days. Yeah, so you have very few days when you're not bleeding, and so the woman can easily go into a state of anemia. You can have low state of blood.
Okay.
Yes. Another common is the feeling of a mass in the abdomen. So you either feel the mass, or you see that your belly is growing. Yeah, so if it is a mass feeling, you feel, and you can actually feel a hard mass inside.
Does it come and go, or it's always there?
Well, fibroids, when they are there, unless if they are removed, they always keep growing in size.
I mean the weight, the mass, that weight that you feel like there's something in me, really.
Now, most of them you will be feeling the mass there, it is there, and it will be increasing over time.
Okay.
Some few of them keep, depending on their location, Some of them keep on shifting from one part of the belly to another, and then sometimes you get a relief.
Okay.
Yeah, those are not very, very common, but you feel a mass. So you feel the mass, or sometimes that mass can make you have frequent urination. So you have to, you can't finish urine and feel comfortable. You find after a few minutes you have to go back, and you know, so that's the challenge. Sometimes the effect of the mass is on the stool, so it obstructs because the womb is just in front of the rectum. Yes, where stool is stored before it is expelled. So the mass will be pressing on the stool, and sometimes it can obstruct, or you can be feeling stool passing frequently. And as we had said, some of them, they present with miscarriages. Recurrent miscarriages, and when you go and evaluate, it is fibroids. Those are usually fibroids which are hanging inside the uterus. Yes.
Thank you so much.
But again, there are others which have no symptoms. So absence of symptoms does not mean there are no fibroids. Yes.
Thank you. Before we look at the effects of fibroids, let's first look at the age group, the age gap that is so eligible to getting.
So we now know that fibroid is a hormone-dependent condition.
Okay.
Fibroids are sensitive to estrogen and progesterone. So we see fibroids actively more commonly in the reproductive age, about 25 to 45.
Okay.
And the peak is around 30 to 40 years. So those are the people commonly with fibroids.
Okay.
Yeah.
Thank you so much. So in case you're watching and you're following, be very mindful of your body weight. Eat very good meals and a balanced diet. Do exercises and tone yourself. I think I'm also in that age, that weight I need to work around to make sure at least my weight is very normal for that. And doctor is advising us, especially ladies, to look out for the signs. Don't ignore some of those signs. You might think you have heavy periods and it's normal because your mother also, someone in the family used to have it. Of late, it's a little different, so you need to watch out and follow up immediately. You could be developing it. Doctor, we go back to the effects of fibroids to a woman.
Yeah.
Yes.
So the commonest concern for fibroids is in our population is its relationship with fertility.
Okay.
Now, we do know that some fibroids do impair somebody's ability to carry a pregnancy to term. They can cause miscarriages. Very, very few cases do prevent pregnancy completely.
Okay.
Especially those which are very, very big, they could prevent pregnancy. Yes. But in most cases, it is the miscarriages which are associated with fibroids.
Okay. Thank you.
Yeah, but also others is the heavy periods they have. Yeah, the heavy periods the women have causes them to get anemia. So they become anemic. Yes.
Does fibroid kill?
Fibroid per se should not kill. The other good news is fibroids don't become cancers. This is true.
Okay.
But there are some cancers which present like fibroids. Yeah, there are some cancers. Yeah, cancers of the womb. Some of them present like fibroids.
Okay.
But fibroids per se do not become cancers. Yes.
Okay.
Yeah. So as I said, fibroid per se should not kill somebody, but its complications can kill. For example, if somebody becomes anemic.
Anemic, yes.
Yeah, for a long period of time, and nothing is done, they could die because of the anemia.
Okay.
But also the management and the mismanagement of fibroid is another big concern. So the management of fibroid, if the decision and its application is not well done, you could end up with a complication which could take out somebody's life.
Thank you so much.
Yes.
Okay, doctor. Let's look at this illustration. There's an illustration we had, and it was showing us exactly where fibroids land into the uterus of
yes, I think it is illustration number 2.
Yes. We could see and we understand better. I think it's this?
Yes.
Yes.
So again, we can look at this. For ease of description, we usually put fibroids in the categories. There are those fibroids which are graded as 0 and they hang inside the womb. Now, when they hang inside like this, we refer to this as we refer to them as pedunculated submucosal. I mean, they arise from the muscle, they have grown inside and they have lifted this up and it is now hanging inside like this. Yeah. But also there are those which are bulging inside, but most of it is still within the muscle wall. So, and then the others which are within the muscle wall, not bulging outside and not bulging inside, not bulging inside, not bulging outside.
Okay.
Then there are those which are bulging outside, like these, as huge as this. Now, the ones which are really of importance are these ones.
Which are around the uterine walls.
Yeah, bumping inside. They are bulging inside. These are the ones which are associated with miscarriages and heavy periods. But now we're also beginning to understand that there is a chemical effect of the presence of a fibroid on the activity of the womb. That the presence of the fibroid causes the womb to go into contractions. So even if the fibroid is not peeping inside, it could cause contractions in early pregnancy and cause a miscarriage. So if somebody has fibroids, even if it is like this one, or it is like this one or this one, which is not peeping inside, and the person has had like 1 or 2 miscarriages, especially even if it's just 1 miscarriage, then it is a justification for dealing with the fibroid if you do not have an explanation, any other explanation for that miscarriage.
Okay.
Yep.
Thank you so much. Someone was asking me that that big one up there,
yes,
it grows and enlarges to a very larger extent.
Yes.
Doesn't it put other organs at risk?
Yes, so sometimes these fibroids, like these which become huge, will start hanging outside, like how this one is hanging outside, inside here. Now, you know, if it is become so big, it will press on other organs, like the intestines. It can press on the bladder. And sometimes it loses the blood supply from the womb, and then it gets another blood supply from the other organs. And that's when we call it parasitic. And some of them detach from the womb and they start wandering around. So you find the fibroid is up on the diaphragm when the womb is down. Not common, but it does happen, parasitic fibroids. Okay. So that can happen and can have some effect on other organs.
Okay.
Yep.
Thank you so much, Doctor. Yeah. If you remove these fibroids, are there chances that it can grow again?
Yeah. So fibroids, as we discussed a bit, some of the risk factors for fibroids are hormones, and some of it is genetic. Yes. Now, if the risk factor is not removed, and you remove the fibroids, the risk factor will still play its role, and the fibroid comes back.
Okay.
Yeah, it's not the ones which you remove that came back. It's new ones which showed up because of the risk factor, or they were too small for you to see them. And so, because fibroids like this, one of them actually starts from one cell. That is what we know. So if it is still at the level of the cell, you may not be able to see it during the surgery. Okay. And so it can grow up.
And it has grown to be big.
Yes.
Thank you so much, Doctor. You can greatly have your seat.
Thank you.
We're still on the treatment, Doctor.
Yes.
How do you treat these fibroids? Do you have antibiotics? Do you carry out surgeries? How exactly do you do it?
So the treatment of fibroids has evolved over time. Some of the methods of treatment are old, others are new. We have a number of treatment options. Okay. The oldest method of treating fibroids is really to remove the fibroids. So it's surgery, you remove the fibroids. You can either use the usual open technique, or you can use laparoscopy, keyhole surgery. Okay. So you remove them out, as you can see logically. Yes. But now there are other options which we have available now. You could block the blood supply you do a procedure where you block the blood supply to the fibroid, and then the fibroid sort of dries out. Yes, so you can do that. Or you can use some high frequency ultrasound. It's one of the most recent methods of treatment, and it's effective and really one of the least invasive. The only challenge with it is the modality is very, very expensive. That unit, to install it, is quite expensive. Most countries don't have it. Okay.
Do we have it here at Bethany?
We don't have it at Bethany, but we also don't have it in Uganda. I think in Africa, maybe there are like 2 centers which have it. Now I know of only 2 centers. Okay. Yeah, so they are quite expensive. One unit costs, I think, about $3 million US. Just one unit. Wow. The simplest and the cheapest. Yeah, so it's quite costly, that unit, but if it becomes available, it is one of the best.
Okay.
It's ultrasound, high frequency ultrasound, and less invasive. The fibroid shrinks off.
Thank you so much, Doctor, for all the illustration. It's still Medical Mind. We are going to have a very short break. Please be part of us by dialing 0786 050 762. In case you want to direct your question straight to Doctor, he's here in the studio and talking about fibroids. Please keep with us. We are coming back shortly.
Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health.
I'm Dr. Gerard Mutunji. I am Assistant Commissioner in charge of non-communicable diseases here at the Ministry of Health. I want to wish Ugandans a Merry Christmas, but also advise them during this time of merrymaking how to avoid non-communicable diseases. Please note that they are not going for holidays as well. They are with us and we need to behave correctly during these festive seasons. So in terms of eating, ensure that you maintain healthy eating, avoid lots of food, take only what is necessary, don't take a lot of foods, and avoid food with lots of fat, avoid lots of sugar, avoid lots of salt, eat our healthy foods, probably boiled or if fried with less oil. Don't indulge in alcohol, in tobacco, and please, whenever you get some time, do physical exercises. Do exercises to keep healthy. Non-communicable diseases are not going on holiday, they are going to stay with us. Thank you very much and Merry Christmas and Happy New Year.
Bethany TV for health.
Much for keeping it on Bethany TV. This is Medical Mind. Welcome back from the brief break. I think you had a very clear message from Dr. Gerard, and he's telling us to exercise that non-communicable disease, they don't go on holidays. Yes. They will always be part of us. Thank you so much. Welcome back. It's still Medical Minds, and we are looking at fibroids. Before we went for the break, Doctor was showing us an illustration of what takes place in the womb, or where exactly the fibroids lands in the womb of a lady or a woman or a mother. We are going to open our lines. Our lines are open, as you can look through the screen. The numbers are running there, 0786 050 762. Please give us a call, and then Doctor gives you your answers back your query there and then. Doctor, let's look at these illustrations here.
The treatments we hadn't finished.
We had
tackled surgery.
We had tackled surgery. What is hysterectomy?
Yeah, so we can look at the remaining options.
Yes,
so we looked at the option of surgery, where you remove the fibroid. We looked at blocking the blood vessel, uterine artery embolization. We looked at high-frequency ultrasound, which is, I was saying, it's expensive.
Yes, which we
the
don't
unit
have
is
yet.
still very expensive.
Okay.
But in some cases, you can use medications. There are some medicines which you can use, either to control the effects of fibroids or to treat, to reduce the size of the fibroids.
Okay, doctor, you have a caller on the line. Yeah. Bethany TV, hello.
Hello.
Hello, my dear.
Good evening. My name is Mildram.
Yes, Mildram.
I'm actually suffering from exactly what you're discussing. Yes, I'm exactly suffering from what you're discussing.
Okay.
And I've been scheduled for an operation, and the doctor had told me I needed blood of about 10 units.
Okay.
And then for now I've raised up to 9.4.
Okay.
But she insists that I will need to be transfused, and I'm not very comfortable with the transfusion. Is there any other way I could have these fibroids managed without the operation?
Thank you so much for your inquiry.
I'm really so worried because I'm not comfortable with the transfusion, but I've really tried to raise my blood up to 9.4.
Okay.
And I'm struggling. The truth is I'm really struggling. I'm very impressed about the discussion you're having because it's exactly what I'm going through. Thank you.
Thank you so much for the call, my dear. Take courage. Doctor, you've had her.
Yes, I didn't get her names.
Mildred?
Oh yeah, Mildred. Yes, Mildred, that's a very good question. I mean, a concern, and it's common actually. Now, as we had said, fibroids, one of the commonest things is you lose a lot of blood and you can become anemic. Yeah. But to be specific to her situation, I think the doctor should be able to discuss with you the options. But in case you are to do surgery and you have the challenge of the blood not picking up with all the medications, there is the option of using some other types of medication which actually stop your periods. There are medicines to stop your period. So you can stop the period.
You don't lose the blood again.
Yes, so you stop the periods temporarily, and over a certain period of time, like 1 or 2 months, you are able to build up your blood. And then you can comfortably do the surgery.
Okay.
So that option is there. There are different medicines which are available to interrupt the period. Okay. Yeah, and that shouldn't worry you. That sometimes the ladies, they get worried about the interruption of the period because they know that this is a sign of, period is taken as a sign of fertility, which is the truth. True. But the doctors, they know the details of how these things work, and so if the period is interrupted just temporarily, there's no problem with that. Okay. Yeah. So the doctor should be able to help you. Your issues will not stress you too much. It will just be a matter of some more time. So there are medications which are available, others are injections, others are tablets. Your gynecologist will be able to discuss that with you.
Thank you so much.
Yes.
I think you've got the answer from the Dr. Mildred. Please kindly talk to your specialist and you see how best he can advise you. Okay. The lines are still open. The numbers are running through the screen. You can still call and be specific and ask the doctor so that he can give you out the answer or the question that you're looking for. Yasin, you could use this number. It is okay. We have a voice note.
Good evening, how are you? This is Rahma calling from Maya. Yeah, doctor, I have 2 kids. In between, up to now, my boy, the last born, is 8 years. In between, I had an abortion. It's like now, as per now, I'm struggling to conceive. It's like I'm failing. Yeah, doctor, that's my question. What's all out? How can you help me? Thank you very much.
Thank you so much. Did you get the audio well, doctor?
Yes, I think she's asking about, she's concerned that her last baby is about 8 years. And then after that, she got a pregnancy, which I think ended up as a miscarriage. And now she's struggling to get another pregnancy and it's not coming. Yeah, so she's wondering what can be done for her. So I think she had some other baby before, yeah. So this case, thank you again for raising that concern. Now, from my assessment, from my thinking, most likely maybe the tubes may have gotten issues with the following the miscarriage, because one of the challenges with miscarriage is if it's not managed well, people get infections in the womb, and the infections go into the tubes, and the tubes actually get blocked. You know, the fallopian tubes, the tubes where the eggs and the sperms pass, where fertilization occurs, they are very narrow, they are very thin structures. Any slight narrowing of the lumen of the tube by any scars from an infection can actually block them. Okay. So she needs her tubes evaluated, and maybe some other additional tests like hormones.
Thank you so much, Doctor. You have another call on the line. Bethany TV, hello.
Hello.
Hello. Good evening. Hello, caller.
I think the line got off.
I think we've lost her. Sorry. Are you on? Yes, please, we can hear you. Oh, yes, please, go on and ask your question.
But when I just get on the...
You're breaking. We can't hear you well.
The line is on and off. Maybe.
Sorry, I think,
technical.
Just in case you're making your call, make sure you're not so close to your TV set. It can disrupt, the communication, and you keep bouncing on and off. So you just extend or switch it off, and then you give us a call. Someone else on the line, hello?
Hello, good evening.
Good evening to you, how are you?
I'm fine.
Where are you calling from? What's your name?
I'm calling from Kampala, I'm in Kasanga.
Okay, what's your name?
I'm Emma.
Yes, Emma.
It is certain that I'm a male.
Oh, no, it's please. Okay. No worry. Go on.
Can she get pregnant during her periods?
Okay.
Or she just wants to take my money?
Sorry about that, Emma.
Just enlighten me on those periods, because I get confused.
So you want to know whether she can get pregnant during her periods?
Exactly. Maybe I messed up, I don't know.
Thank you so much, Emma. Doctor is here. He's going to give you more light about that. Emma is concerned. Thanks so much for the call, Emma. Doctor is getting back to you.
Yeah, Emma is asking if a lady can get pregnant during her
periods.
Periods.
She's worried the lady's just...
based on the physiology that we know, that shouldn't happen, because the environment in the womb is unfavorable for the sperms to pass through. That shouldn't happen. But sometimes people confuse periods with some other condition called implantation bleeding.
Okay.
Yeah. So if in a situation where somebody is where people are having repeated sexual encounters, the cervix and even the tube, even the womb stores sperms a bit, and so it goes ahead and fertilizes and causes implantation, and then gets implantation bleeding. Pregnancy is occurring, but there's some spotting because of the way the baby is attaching itself. Sometimes this can be so significant that it is of concern, but the actual period should not allow a pregnancy to occur. Okay. Yeah, but sometimes it's confused with implantation bleeding.
Thank you so much, Dr. Emma. I think you've got your answer right. Doctor is saying pregnancy does not take place when someone is in their periods. It's always after or before, towards ovulation. Yes, so please take time and discuss it with your partner. You see how best you can plan, but she cannot conceive during her periods. We have a question here, Doctor. She's saying, good evening, thanks for the good work you're doing. My question is, what causes molar pregnancy? This is a very big question and a topic of its own to discuss, but briefly, since she's our follower.
So we can actually answer that one a bit. First of all, what a molar pregnancy is. So what happens is usually in the normal, it's one of the abnormal forms of pregnancy. So usually when fertilization occurs, that is the egg gets to meet the sperm, that is the egg gets fertilized by the sperm. That marks the beginning of the life of an individual. This happens in the tube, And so this is one cell created from 2 half cells, literally. And so this is the real human being actually, but one cell. And it starts dividing into more cells and more cells. And as you get more cells, they now model themselves into a human being. So these cells start differentiating. Others become muscles, others become bones, cells of the bones, others become the eye, others become the nerves. And so eventually the human body takes shape. Now, and then some of the cells become placenta and the covering membranes. Yeah. Now, if you get problems with this differentiation, sometimes the differentiation takes the form of grapes. Instead of the cells taking the shape of human beings, they take shape of small cysts, and that's what's called molar pregnancy. It's an abnormal differentiated form of pregnancy. Now, based on the genetic analysis of these molar pregnancies, we know that there are certain causes of molar pregnancy. For example, one sperm is supposed to enter one egg. Yes. Sometimes 2 sperms enter one egg. Now, in that case, the genetic material is not balanced. There's twice the size of the amount of the genetic material from the sperm now. 2 sperms going in, that means they are bringing 2 sets. And so the differentiation of such a pregnancy will not be normal. So more sperms entering into one egg is one of the causes of molar pregnancy. Sometimes it is one sperm which was not formed very well. It has double the genetic material, and so it causes molar pregnancy to come. Yes, but in some cases we do not know the cause. Okay. What is not very clear is the risk factor for abnormal formation or behavior of the sperms.
Okay.
Sometimes it is age-related, sometimes it is some other factors which are not yet known.
Thank you so much,
yes.
Doctor. We still have other questions, but we can answer them as we go along. Yeah. Do we have another call on the line? Okay, I think we lost him. There is another question here. This is still, I think, Rema saying, yes, Doctor, thanks for your reaction to my question. How can I go about to overcome that problem of fibroids? I think I'm going to ask this question again. There's someone on the line. Medical Minds, hello.
Hello.
Hello. Good evening, doctor is listening to you. Who is calling? Where are you calling from? Okay, can you switch off your TV set? We can't hear you well.
We're getting echoes. Maybe they move.
Or you can extend away from your television set.
Okay, getting. Doctor, you see, what you have been is up.
We are losing you, my dear. You're so close to your TV set.
I don't know how I can explain it. What you have explained, what thing do?
The line is
the line is being disrupted, my dear.
Maybe the TV.
Please, just in case you're making any call, dear our viewer, just make sure you're away from your TV set, or you switch it off. Give us your call, then you switch it back as you listen to the response to the doctor. I was still reading for you another comment, doctor. She's saying this is kindly talk about how she can overcome the problem. I think this is the same thing that you've answered here. This is the same person. She's again asking about contraceptives and fibroids. I think it's still a very lengthy topic to discuss.
Yeah, so she's asking, what is she asking specifically about contraceptives?
The relationship between contraceptives
and fibroids. Yes.
Some women think that taking contraceptives or family planning causes fibroids.
Yes. Really, actually, the truth is, okay, we have different types of contraceptives. There are those which are non-hormonal, which don't have hormones in them. Those ones, I think most people don't have any worries about them in relation to fibroids. I think they are concerned about the ones where there are some hormones.
Okay.
Because we know that we always tell people that it is the high levels of the estrogen, which estrogen or progesterone, which are related to the fibroids. Now, the effect of the regular use of contraceptives on fibroids is quite negligible. the blood concentrations of the estrogens and progesterone, which are caused by the contraceptives, are so low that they cannot cause for you fibroids. They cannot be implicated in because you need very high levels of these estrogens to be able to have issues with fibroids. Yeah, so technically we are not worried about that.
Okay.
Yes.
Thank you so much. This is Cosmas Opera is saying, thank you so much, Doctor, for the show. I think he's enjoying and watching with the family members. Thanks so much, Cosmas. We have a question. There is a question, I think, we didn't react to. Hello, Bethan TV. Thank you for your program. Very educative. My name is Eunice from Chitende. Can we have the contact for Dr. Gonzaga? No worry. You can get him at the clinic. Just in case you want to really talk to him, you can find him at Luzira, Bethana Women Hospital. You can find him there. And there is another question here coming up. Hello, I am Dr. Paul. The name is a little complicated. Pookie, something like that. I wanted to ask, are routine fibroids linked to face acne? Routine fibroids. Uterine? I think fibroids. It's uterine. Yes, I think it's the way he wrote it. It's uterine fibroids, yes.
Yes. So
linked to face acne?
We can ask that. We can answer that one.
Okay.
The answer is no. Okay. No direct. Fibroids don't cause acne. But both fibroids and acne are conditions which are exacerbated or are both can result from high levels of hormones. So they have the same risk factors. Yes, for example, the estrogens, progesterones, they always go together with the high levels of the testosterone hormones. Okay. So those are responsible for the acne people get, especially the progesterone, because progesterone has the androgen sort of effects. The androgens are male hormones. Testosterone is one of them. Those are related to acne. Yes. But also progesterone and estrogen on the other side increase the risk of high levels of them increase the risk of developing fibroids. So that's why you find you'll find fibroids in people who are fat, more commonly in people who are fat. These are the people who are more likely to have acne, and all that is because of the underlying hormone issues.
The hormone imbalance there.
The hormone imbalance, and most especially higher levels of these steroid hormones.
Thank you so much, Doctor.
Yes.
We have a few questions still coming in. Hello, please. I'm a breastfeeding mother. My baby is 6 months old, and I'm in family planning using injections of 3 months. But I haven't seen my periods tested for pregnancy. I'm not pregnant. What could it be?
Oh, yeah. So the injectable contraceptive has progesterone.
Oh.
Yeah, so progesterone, when you take it in the depot form and in a higher dose, it can actually take away your periods by switching off the influence of the brain on the reproductive system, but also by thinning the lining of the womb. And so if these two act together, and especially if the levels are still high, that is most likely the effect. So we call it amenorrhea related to contraception. Okay. Yeah, so it's okay. It's not to worry. It's one of the things. If she has any more worries related to the effects of these contraceptives she's using, she has to discuss it with the health worker, because there are other concerns which probably she may get. For example, the periods have disappeared now, but when they come back, they might be irregular. So they might be spotting, they may be heavy. Okay. And those are still normal things, but she needs to get to know this.
Thank you so much, Doctor. We're still having some more. Just in case you're following us, it's Medical Mind. Please send us your inquiries, plus your name and location where you're calling from. You're saying, hello, I normally have high pressure when I conceive. I've tried the gynecologists, but I normally lose my babies at 6 months. Oh dear, sorry. I only got a baby who is 7 years, but she was a premature. What a condition. Yeah, so the conditions he's talking about is high blood pressure. Yes, so it's called pregnancy-induced hypertension. Okay. We call it preeclampsia. Now, this condition, in most cases, it should be manageable
But unfortunately, in some cases, especially if it starts early, it may get out of hand, and it can result into premature birth, or even pregnancy being terminated early, so as to save the life of the mother.
Okay.
Yeah.
Okay.
Sometimes it has some underlying conditions. It needs that to be evaluated. But in case that is not possible, and it is threatening her life, and yet she needs to get her baby, those are situations where she may need to consider somebody else to carry for her.
Okay.
It may be costly, but that is like one of the last options. If there are no other options, it may be safer for her.
Okay.
Yep.
Thank you so much. I think you've got your feedback from doctor. Another one is saying, good evening. My wife has got these symptoms you mentioned, prolonged periods for about 7 days. She has constipation. We have 3 boys, but she says she is normal. Sometime during sexual intercourse, she complains of pain in the lower abdomen. What could that be?
Well, to know whether somebody has the fibroids or some other condition, because fibroids are one of the common causes of that type of bleeding we described, but also the other conditions called adenomyosis. Yes, or it could be hormone related. So she needs an evaluation. Just by her thinking that she's normal is not enough. The fact that she's having those problems means there is a problem. She needs that evaluation to be done by a doctor, preferably a gynecologist, to be the one to evaluate. So we advise him to encourage the wife to go for a checkup. Yes.
Okay. Thank you so much, doctor. I think others are still coming in. There's someone is saying, doctor, kindly tell us again, why does the non-hormonal IUD make our periods too heavy? This is family planning still.
Yes. So IUD, that is the copper IUD, that's what they're asking about. Yes, having heavy periods with IUD is quite common actually. I think about 4 or 6 out of 10 people get heavy periods when they're using IUD, especially at the beginning. They can also get cramps. And it's because when an IUD is put inside the womb, it's a foreign body. And it can cause inflammation or reaction. And now, this reaction, if it happens at the time of the period...
Doctor, just shortly, you have someone who want to talk to you badly. Caller, hello?
Hello?
Yes, please.
This is Apio. This is Apio.
Apio, you're so close to your TV. Can you kindly get a distance or switch it off?
Yeah. Doctor,
we are losing you, my dear.
You can.
I'm asking.
Yes, please.
But whatever, what he has explained the symptoms, I normally get the symptoms. Can it cause malaria also, or?
The symptoms of?
The symptom of whatever, of that of fibroids.
Fibroids.
For fibroids.
So I think she's asking.
Can it cause malaria? Because at times when the pains come, I can get my... Then bleeding also can cause like 5 to 6 days, some watery bleeding.
So you're worried that they can cause malaria? Are they connected, doctor?
I think what she's asking is, people call fever malaria. So it looks like when she's getting heavy periods and the pain, she feels feverish. Yes.
Okay.
And I also hear that she's saying sometimes she's getting watery discharge. Now, fibroids per se should not cause fever. But feeling of unwellness because of complications of fibroids is common. Maybe because of the excessive pain, your body can react and you feel as if you have fever, but you are just having the pain here. Or it could be the chronic low levels of blood which she's having could give her fever-like feeling. But also it could be a real fever because of infections in the womb, and associated infections. Since she talked about a discharge.
Yes.
Yeah, so this has to be evaluated, and if she's already getting those challenges with fibroids, it means they need to be managed. So not allow it to get on. These are some of the just reasons why you may need to go ahead and have the fibroid removed.
Okay.
Yes.
Thank you so much, Doctor. Yeah. Up here, I think you've got the response from Doctor. There is someone saying, I'm going to read two messages, Doctor. One is saying he got to know that he has candida yesterday. How can he treat it? The other one is saying, good evening, Bethany TV. Thank you for the show. I'm Sheila from Kampala. The doctor has stated that fibroids can be caused by a high level of estrogen hormone. I have read that consuming animal products, especially red meat, dairy products, and fish causes the fibroids to grow larger or come back after surgery. Is it true, Doctor?
Yeah. Okay. So we can talk about this last one. I'm very encouraged by this person who is reading further. Yeah. The baseline is exposing the uterine muscles to high levels of estrogens, like of hormones like estrogen and progesterone. Now, these hormones, estrogen and progesterone, we call them steroid hormones. They are chemically in the group of steroid hormones. Okay. They are derived from another molecule called cholesterol. Now, cholesterol we know is a form of fat, and cholesterol is plenty in animal fat. You have it, yes, in animal foods. You have it in milk, you have it in eggs, you have any animal, even meat, the meat which you eat has a lot of cholesterol. So if somebody takes a lot of milk, takes a lot of meat, food which contains a lot of cholesterol, the person is providing raw material for production of estrogen and progesterone in their body. Okay. And so their estrogen and progesterone levels are likely to be high. That's how proper management of weight can control the risk of fibroids. Of you getting fibroids. Yeah, and even the fibroids growing bigger.
Thank you so much, Doctor. Yep. I think we're almost coming to the end of the show, and because of time, we are going to break off shortly now. In case you're still sending in your inquiries, please feel free to send them in. Doctor will be able perhaps to respond to them the next coming Sunday. Please don't forget to always join Bethany Santa Omugabi by watching all the station programs and knowing the presenter, so that in case you see him around, you give him a call and you win yourself a very big Christmas gift. Doctor, we're going to our last segment. True or false?
Oh yeah, okay.
Yes, I'm asking you a question that has been sent in by different people and mothers out, and they want to know the reality. Number one is, fibroids are cancerous growth in the uterus. True or false?
False.
Very good. Mothers, I'm sure you're listening. Please take note. Number two, fibroids are genetically inherited. True or false?
So yes, it is true. Some types of fibroids have genetic risk factors. That's why you find it, they run in siblings, they run in, the mother had it, the children are going to have it, the grandchildren, like that. So there's some genetic risk factor.
Thank you so much.
Yes.
And second last, fibroid can cause frequent urination, pelvic pain, and lower abdominal pressure. True or false?
It is true.
Thank you so much.
And that's one of the commonest symptoms of fibroids.
That can mass effect.
Yes.
Thank you so much. Yeah. And then lastly, Doctor, fibroids are common in fat women. True or false?
That observation is true, and it is because of the relatively high level of hormones, the estrogen and progesterone, in people who are a bit fat. Okay. That's why it's important to manage your weight as one of the ways of managing the size of your fibroids. If you diagnose that you have fibroids, it's your responsibility to make sure that your body mass index is kept within normal range, by doing exercises and by feeding well.
Thank you so much, Doctor. It has been wonderful hosting you once again, and we thank you for all the illustrations and giving back the feedback to the viewer. To the mother who is watching you there and she's going through this everything that you've explained, please give a word of courage.
Yeah, so what I want to tell people is that I think we overrate fibroids, to be sincere. Not all cases of fibroids need to be treated. Some of them just need follow-up. Yeah, so fibroids should not be over-stigmatized. Fibroids are not cancers. People need to know that. And the other thing is, fibroids have treatment. Fibroids rarely kill. It is the management or mismanagement of the fibroids which kill, or maybe complications like low blood level. So if you suspect you have fibroids, please get checked up. read about the condition also yourself, but interact with your health worker properly to understand, is mine to be treated or not. But
thank you so much. That has brought us to the end of the show. We've been looking at fibroids and the causes, the treatment, and all ways of preventing it. Just in case you've missed us, please, you can still catch up next Sunday, the same time, the same TV station, with me, Teacher Zita, and Dr. Andabati. Together with my team, I think we're signing out. Thanks so much for being part of us. Have a good night.
Bethany TV, for health.
So I'm called Dr. Kenneth Kalani. I'm a psychiatrist and senior medical officer at the Ministry of Health in Uganda. So as we break up for the festive season, Christmas, I would like to extend some message from the mental health division of the Ministry of Health. One is, as we break off and we join our family, friends and family, some of us go to the villages, let's take time to understand each other. It's been a tough year for all of us, and some of us have been going through challenges, and maybe that opportunity to speak to someone has